Good. Good morning, everybody, and thank you for joining us this morning. Hopefully, you have a cup of coffee in front of you, and if not, just glad you're here. This is our first of regular town hall meetings. We plan to have these every 6 weeks or so, more frequently as we have things to update you with, and perhaps a little less frequently. We have fewer, but generally every 6 weeks, and want this to be a regular part of how we stay in touch with you and keep you informed on what we're doing to strengthen PAGNY and to help you. Let me start by making a few introductions. To my immediate right is Jorge Montalvo, our Chief Operating Officer. To his right is Diana Voigt, our General Counsel. And then to my left is Joe Monteleone, our Senior Benefits Manager and Senior HR Officer. And to his left, getting my directions confused, is Anthony Rodita, our Chief Financial Officer. And our newest member, who is starting today, is Michelle Ronquillo, who is our new Chief Human Resources Officer. And welcome, Michelle. We are not going to put Michelle on the spot today, but she is here with all of her energy, and we're excited to have her. The agenda for today, if we could have the next one. The agenda for today, I'm going to talk a little bit, just briefly, about my background and then give a little bit of some vision and strategy as far as the direction we want to take the organization. We're going to give you an update on the upcoming health insurance plan changes. As I think many of you know, open enrollment starts today and goes through November 7th. So we're going to talk a little bit about that, and we'll have much more information coming to you, but this will give you a general overview. We're going to give you a brief update on the contract negotiation with H&H. And then, of course, we'll have time for questions from you. Please use the Q&A function to send us questions throughout the presentation. And then as we get towards the end, the last 15, 20 minutes, we will answer those as they come in the order that they've been asked. So thank you. With that, let me show you, if you can't see me in person, there's a picture of me. I don't know if it's my best or my worst. It's certainly, I look about the same. But let me start by first giving you a sincere thanks for all the work that you've done throughout the pandemic and COVID crisis. I know I spent the last year at the state helping to operationalize and strategize with many of the COVID strategies, and it was hard work. But it was not frontline work. You all were on the front line, and what a difference you made. And you were on the front line of some of the most challenging places with some of our most sickest patients. And it was just incredible. The stories I've heard and seen about the efforts that you've made and continue to make are really moving and make me proud just as a New Yorker, but make me proud now, even prouder as the CEO of PAGNY. So I just wanted to say thank you for all that you've done, the sacrifices you've made, you and your families, and we really appreciate and respect that, as do, I know, the many patients that we serve in our communities. And so, that's a great segue to me. I've been in healthcare my entire career. I'm an anesthesia and critical care physician, practiced, and I worked, I guess the thing to know is I've worked in many different settings. I've worked as a clinician for many, many years. I've worked as a researcher and an educator in medical education with a university. I've worked in teaching hospitals. I've worked in the for-profit setting. I've worked in the nonprofit hospital setting. I've managed large physician groups affiliated with those hospitals. I've worked on the business side. I've worked with private equity and investment funds, advising them on what types of acquisitions they should do or should not do. And then I've worked in distressed organizations, helping to turn them around. And then most recently, I worked, as I mentioned, in state government, working first for the former governor and then in the Department of Health, really working both on COVID and also some really important policy issues that are in the communities that our organization, PAGNY, serves. And I think that the board picked me for this position, for which I'm really flattered and honored because of my diverse background and the vision that the board has for how PAGNY should move forward in the future. So let me share a little bit with you that vision and strategy. I really applaud the board, the management team, and really all of PAGNY for how the organization has developed over the past 10 years. It's a very strong organization, and the scale of it, we have around 2,500 physicians and 1,300 advanced level providers. The scale of that is enormous, and a lot has been done to align that internally and to really use everyone's talents and skills to fulfill the obligation we have to H&H and our patient community, our combined patient community. We do a great job of that in very tough circumstances very often. What the future is now is as the healthcare system transforms and moves towards more structured and more organized and more value-based, that is more risk-based reimbursement, how do we change as a physician and provider organization to align with that transformation? And it's not just about H&H, it's really aligning with how medicine is practiced and where the focus is, which is really keeping people healthy, making communities healthier, and having them rely less on in-hospital services, but when they need the hospital, making sure that it's efficient and high quality and really best in class. And that's what we want to get to. We are in a perfect position to have an enormous impact on accomplishing that goal. So our strategy then has to be one of alignment. How do we accomplish that with what we've got? Great people, great skills, committed workers, smart people. We need to drill deep and invest in ourselves. We need systems that tell us what we do and how we do it. And that's where we're going to go. We're going to make sure that when someone asks us, well, what is PAGNY and what is a PAGNY physician and what does that represent, that we can say, well, let me not just tell you how great we are, let me show you how great we are. And we're going to demonstrate that and be able to do that in any setting, which will make people want to partner with us for numerous types of growth opportunities. Our people, you all, are our greatest asset, and we intend to leverage that for additional strength and growth. We're going to come back to how we're going to do that in a little bit, but first I'm going to ask my colleague, Joe Montoliano to my left, to talk a little bit about health insurance. So Joe, take it away.
Thank you, Dr. Becker. As we previously communicated to everyone, effective January 1, 2022, we're changing the plan administrator for the health plan and the flexible spending accounts from United Healthcare to Aetna, and for the RX plan from United Healthcare to CVS Caremark. We're going to continue to offer the same plans that we offer right now. You're going to see on the medical plans, open enrollment starts today. You'll still see Plan 1, Plan 2, and Plan 3 listed as your medical options. There's no change in the plan design. There's no change in the cost. In the RX plan, any employee that's enrolled in the medical plan and any dependent will also be covered in the RX plan. Nothing is changing there. On average, PAGNY pays 96% of the costs for our medical and our RX plan. Employees pay around 4%. To give you a little perspective on how rich these benefits are, in the healthcare industry, the average is that the employer pays 66%, and participants pay 34%. So we're going to continue to offer the same plans at the same cost. The reasons for changing the plan administrator is, again, as you're all aware of, effective January 1 of this year, Montefiore Health Systems left the United Healthcare network, which had a huge impact on our employees, especially those who live in the Bronx and Westchester, Putnam County. Montefiore is a huge provider in those areas. To give you an idea of the impact, in 2020, Montefiore represented $1.2 million worth of claims that were processed through the plan. As an out-of-network provider, the majority of that $1.2 million would have been paid by the plan participants. As an in-network provider, the majority, overwhelming 96% plus, is paid by the plan. So you can understand the impact Montefiore had on our population. There are other reasons as well. The last couple of years, we've seen significant issues with United Healthcare's customer service. 2 years in a row, they ran system updates that caused all our participants to be terminated for a day. They've also sent out incorrect letters to our participants informing them that a prescription that they're currently receiving is no longer covered by the plan. There's also anyone who's had behavioral health claims understands the difficulty with United Healthcare and getting those claims processed. So when we looked at it at Aetna, our focus was, and CVS Caremark, was on their administrative processes, their checks and balances, the inclusion of PAGNY in any communications that were sent out. And we're confident that these type of issues that we had under United Healthcare will not occur under CVS and with CVS Caremark and Aetna. So I've mentioned a couple times plan administrator. I think it's important to understand the role that United Healthcare currently plays and the role that Aetna and CVS Caremark will play with the plan. These are PAGNY plans. PAGNY is a self-insured medical and RX plan. PAGNY pays the cost of the claims. We designed the plan. We determined the co-pays, the out-of-pocket deductibles, co-insurance. We determined the premiums that employees pay. But we need to pay an insurance carrier to serve as the administrator. What the administrator does is they process the claims that are submitted. They provide you with your ID cards, customer service number, website, and the network of physicians. So that's what the administrator does. But they are PAGNY plans, and everything within those plans is determined and decided by PAGNY. And part of this change when new administrators, none of those things are changing. The process of identifying Aetna and CVS Caremark as the best fits for PAGNY started earlier this year. Once we found out Montefiore was not going to be in the United Healthcare network, and as of today, they have still not come to an agreement. We worked with our consulting firm, Willis Towers Watson, to identify the top-rated insurance administrators out there. We sent a request for proposal to them, got their responses, and spent months going through analysis and reviews of their responses and follow-ups with them. That information was presented to the PAGNY Human Resources Committee, which is made up of physicians from each one of our locations. The committee reviewed the information, reviewed the analysis, and unanimously decided to recommend to the PAGNY Board of Directors that we change the plan administrator to Aetna and to CVS Caremark. The Board of Directors, again, which is made up of physicians from all the PAGNY locations, unanimously decided to go with Aetna and CVS Caremark as the new administrators. So why was CVS Caremark and why was Aetna chosen? Well, they were both able to replicate our current plan design. There's no increase in cost or premium. There's very minimal network disruption. Aetna, in fact, has a greater network than UHC when it comes to highly impactful providers. Improved customer service. They can accommodate continuation of care and will not ask for recertification for disabled children. CVS Caremark specializes in RX plan administration, a broad retail pharmacy network, and they're able to continue coverage for previously approved prescriptions, including specialty drugs and mail order. So you probably got last week, I'm sure all of you got the communications about open enrollment starting today. So it goes from today to November 7th. Just like in previous years, open enrollment is handled the same way. All your current coverages will roll over to next year, except for the flexible spending accounts, which require annual enrollment. So even though the plan administrator is changing on the medical plan, the plans themselves are not changing, and you don't have to re-enroll for next year. Everything will carry over. You will be getting new ID cards from Aetna for your medical plan, from CVS Caremark for your prescription coverage. And if you enroll in the flexible spending account, you'll be getting a new flexible spending account debit card from Aetna as well. Thank you.
Thanks, Joe. And so just to keep Joe busy, we gave you his email so that you can email him any questions. That was a great presentation. We're also going to have frequently asked questions, answers to those FAQs coming out shortly to you so that you can have, without even asking, additional information. But by all means, we want to know your questions. And if there are specific concerns that you or your family are facing, we want to know about that too. This was an incredible process that was completed actually before I arrived, but I reviewed the whole process and the work that went into it. And it was impressive, and it was done thoughtfully and carefully to really minimize the impact, given the fact that there was this tremendous disruption beyond our control of Monty leaving the United Healthcare Network. So we've done, I think, as much as any organization could do to preserve your healthcare, to preserve your benefits, and to minimize and hopefully improve the costs to you. But again, it's not perfect. We do want to hear from you if there are specific instances, where there is significant and material disruption. And our commitment is to work with you or your family to help resolve that in a meaningful and satisfying way. And that continues to be ours. So thank you, Joe. And I think thanks to the board, your board and the team did a remarkable job in really putting our staff, your interests first, which is what they always really do. So thank you. Let's talk a little bit more then about the contract update. As all of you know, we support H&H facilities and the H&H mission. H&H, for all of its affiliates, which include NYU and Mount Sinai, we're the largest affiliate contract that they have. They have certain principles that are around, for those affiliates, that are around governance, finance, and then medical and professional affairs. So we've divided them up, and we have principles that are strong principles that you'll see, interestingly, align quite nicely with H&H's principle. So from a governance perspective, H&H's principle is to have overarching governance and management structure that allows for and ensures efficient decision-making. They want a contract that's clear and enforceable, but also adaptable as things change. And then transparency around finance and operations. If you look at our side of the ledger of this table, we want exactly the same thing. We believe that, in fact, our governance is more nimble than H&H's. And I think that's something that Dr. Mitch Katz, the CEO of H&H, would readily admit. And we want to encourage him to use our nimbleness and the fact that we can advance various efforts and decisions, sometimes more easily than an organization their size can. Also, we're the providers. That gives us a unique position from hospital operations, and we want to be aligned and work well. We also want a clear and enforceable contract that works both ways, that's adaptable as healthcare changes and transforms. And finally, we agree with financial and operational transparency. The more we kind of see where we are, where each other is, the better off we are. From a financial perspective, there has to be an alignment of incentives with affiliates and physicians. And we totally agree with that. We believe that there needs not only to be alignment, but there needs to be alignment internally and externally. How people are paid is important. It's important to understand that, yes, showing up to your job is part of it, and then performing in a very outstanding manner is another part of it, and accomplishing the goals of H&H and of PAGNY. And believe me, these are really shared objectives that we'll get into in a second. That is critical. And so we want to reward people for not just showing up, but for advancing the mission and really making PAGNY and H&H outstanding destination organizations. And that's how we want this contract structured. All that said, we want to achieve fair market value compensation with stronger linkages that reward this type of high performance. And then there is alignment as well, close alignment on medical and professional affairs. We want a patient care model that is coordinated and not fragmented. I think one of the things I've noticed as I come in, and I'm the new guy, and there's a lot of strength in H&H and PAGNY, and we have great providers. It's remarkable how committed and wonderful our providers are. But I think anyone will look at us and say it appears a little fragmented, right? Everyone is aligned mostly with the organization or the site at which they work, and less so with the overall mission. And so what we want to do is align our providers with PAGNY and PAGNY's mission more closely with that at H&H. There's some very concrete ways that we can do that. A lot of it involves building the databases that we need so that we can show you how you're performing, how your department is performing in whatever activity, professional activity it is that you do. And that's exactly what we're going to do. I think as people know how they're performing and as they're getting rewarded for that performance, that feeds into recruitment and retention. We want to develop our staff. Every organization I've been at, one of my top priorities has been to understand what people want out of their careers and out of their professional development and try and build programs around that. There are lots of things that you can do. And it's not to say that you need to go do something beyond what you're doing now, but anyone who's interested in developing themselves further in a variety of ways, we want to be there to support you for that. And even if that means I just want to be as good a clinician as I can be, and I want to stay on the cutting edge, we need to do more to help you do that, and we will do that. I think there's tremendous opportunities in research and education. One of the unique things about working with a public health system is the case mix that you see is remarkable. There are so much pathology, medical pathology, clinical pathology that presents itself to our practice every day in our hospitals, in our clinics, and we need to take advantage of that to teach students and residents. We need to take advantage of that, ethically always, of course, to do research, cutting edge research that can help people. And we intend to do that as well. We want to see more research ideas come from PAGNY providers. We think you're in the perfect position to advance research and medical education. So I'm a very visual person, and so I always do better with a diagram than a table. So this is kind of a diagram that has a table in it. So we're getting there. But I think the principles here are important, right? If you look at the top internal box, this is really about the overarching mission: high quality, patient-centric, accessible healthcare delivery that achieves outcomes targets. That's really what we're all here to do. But you can't do that without the bottom box: sustainable financial strength that supports continued investment in the shared mission. So those two are incredibly related to each other, and we need to make sure that they're continuously aligned. That's one of the key thrusts of our discussions with H&H. But in order to get there, we have to show that we mean what we say and that we're doing what we can do. We have to demonstrate that we have consistent clinical strength that builds system and reputational excellence. We have to show that we have leadership when it comes to research and education. We can't be passive about it. We need to be active about it. And we need to create more of a systemness that drives best practices. I'm an anesthesiologist and an intensivist. Intensive care at Harlem Hospital should be the same as intensive care at Jacobi and at Coney and at Metropolitan and so on and so forth. There should not be different varieties and different incentives, quite frankly, for clinical practice. And we intend to create that systemness along with H&H, which is completely aligned with what H&H wants. I think that PAGNY potentially can be heavily rewarded, which means you can be heavily rewarded for helping us create and drive that systemness. If you look at the outside circle, those little boxes, those are kind of the driving principles that will contribute to accomplishing that inner table that I just went through. You need to have integration. We need to be data driven. We always need to be cost effective, making sure that the resources that we have, which are always limited in this environment, are spent effectively. We need to be aligned, and we need to become a high reliability organization. And what that means is that we mean what we say, and we say what we mean, that we really produce the type of care that we speak to and that we want and that we know our patients and communities desire. So finally, for those of you who deal best, as I sometimes do, with just simple bullets, how do we finally get there? Again, I went through many of these points, but we're committed to alignment of the resources to achieve excellence in care delivery to our patients. I think that's the overarching principle. It's not that sometimes care, sometimes we don't achieve that goal, but when we don't achieve that goal, it's 99% in my experience a systems issue. We need to understand why the system didn't allow us to deliver the highest standard of care and then fix it. And we need to be part of that fix. It's not for someone else to fix. We're the ones there on the ground. We need to work with our partners at the H&H sites to make sure that we provide outstanding care. And when it goes wrong, that we understand why. We need to make sure that we use resources efficiently, that optimize access to the entire spectrum of care. That's what we do. That's our commitment to our patients and our communities. But then we also need to make sure that compensation, what you're paid, your total compensation aligns with that performance and productivity. As I mentioned, yes, showing up is part of the game, but really being all in and performing at the highest level is really what gets all of us to a higher level of compensation for what we do. So we are going to be committed to that type of compensation and that type of structure. We need incentives that align with shared clinical and quality objectives. Those will be built in to achieve compensation that you all want and deserve. So in the end, we all want a stronger PAGNY that can grow and develop to serve communities and support our providers. And that's exactly what we want to do in this contract negotiation. So that's really what we have today